We're covering facial muscles, and I'm going to show you just the picture of this model without the muscles, and then I'll move on to show you the key so you can test yourself. So we're going to go through it. I'll show you the key to what we're looking at. As you follow along, see if you can capture what we're looking at. My name is Brad Richardson. I've been teaching anatomy for about 24 years now. I'm trying to make this simple for you. I've also added a study guide to this so you can click below to help you learn the muscular system. So let's go through these muscles so we can see if we can identify them. On the frontal side, where you have the frontal bone, we have this muscle called frontalis. It's also called the frontal belly of Occipitofrontalis because it's extending from the occipital bone to the frontal bone. So Occipitofrontalis, this is the frontal belly or frontalis. As I move over to the lateral side, on the lateral side, you have a muscle that's called Auricularis superior. Auricularis superior. Deep to that is temporalis. So depending on the models or the charts that you use, we would have to go deeper to see temporalis, but on top or superficial to it, you have auricularis superior. As I move anterior, it's called auricularis anterior. Auricularis anterior. So superior and anterior. And I come over to my eyes and one of my circular muscles, if I wrap around my eyes, it's called the Auricularis Oculi. Auricularis Oculi. And you'll see here that there's two numbers that represents Orbicularis Oculi. Orbicularis Oculi has two portions of it. The inner portion is called the palpebrae portion or part, and then the outside, the main portion, is called the orbital. But the entire muscle is called Orbicularis Oculi. As I move down to where I have my nose, along my nose, this is called Nasalis. Nasalis. And then I come just underneath my eye. And when I look just underneath my eye, this is called Levator, Labii Superioris. Labii Superioris. So it's elevating the labii at the superior side. So Levator, Labii Superioris. As I come down, we'll see two of my Zygomaticus muscles. So Zygomaticus major is underneath Zygomaticus minor. So Zygomaticus major, Zygomaticus minor. As I wrap over to where I chew, this big mass of a muscle is called the Masseter. Masseter. So one of our mastication muscles, Masseter. As I wrap across, this one is called Risorius. Risorius. And then as I look inside here, it shows a small portion of Buccinator to blow or compress the cheeks. So as I do this, it's going to expand further, but I can only see this small portion on the model. So in this section, I have Masseter, Risorius, Buccinator, and then my two Zygomaticus muscles, Zygomaticus major, Zygomaticus minor. As I come over and I look at what wraps around my mouth, another circular muscle, Orbicularis Oris. Orbicularis Oris. When I come down and look at the angle of the mouth, this is called Depressor anguli oris. Depressor anguli oris. Next to it, this smaller muscle is Depressor Labii inferioris. So up top here we had Levator Labii superioris. Down here we have Depressor Labii inferioris. And then lastly I add one of our neck muscles that goes from the sternum and clavicle up to the mastoid process, Sternocleidomastoid. Sternocleidomastoid. So take a look. How did you do? A quick review. Frontalis, Auricularis superior, Auricularis anterior, my Orbicularis oculi. I come down to Nasalis, Levator Labii superioris, Zygomaticus minor, Zygomaticus major, Buccinator, Masseter, Risorius, Orbicularis oris. Then I go down to Depressor anguli oris, Depressor Labii inferioris, and Sternocleidomastoid. This is a review of facial muscles.